So let's get started and learn more about this panel. So this is the most complete CBC-based evaluation of immunity. It has 100% of what you find in the allergic tendency panel and 100% of what you find in inflammation level 1. It also has key elements of StressCheck, EndoCheck, and spasophilia, which relate specifically to immunity. So while this panel covers all four types of hypersensitivity syndrome, it really focuses on type 1, which is allergies, and it gives you interpretations and recommendations that are very focused on regulating the immune system. So what can you evaluate with this panel? You can look at systemic and tisular level inflammation. You can look at the hypersensitivity critical terrain. And again, just to remind you, type 1 is IgE mediated, which would be atopic disorders like allergies, asthma, eczema, and urticaria. IgG, so type 2 would be IgG mediated cytotoxicity. Type 3 is immune complex mediated glomerulonephritis, lupus, etc. And type 4 is cell mediated, such as dermatitis. So if your patient has any of these types of disorders, you can use this panel. And you can also look at autoimmunity risk. And of course, certain autoimmune disorders like glomerulonephritis and lupus are autoimmune, but other autoimmune conditions can also be screened using this panel. And what's also new to this panel and new to the family of biology of function indexes is looking at the pre-critical terrain and modeling it in a single index. Well, here's a summary of all the indexes that you'll find in ImmunoCheck, and they're color-coded according to the three groups, the three sections of the report analysis. So in green, you have the allergic tendency index, and then you have the individual indexes which went into determining the allergic tendency and helps you determine those phenotypes. So the algorithms already determine the phenotype for you and recommend the most specific combination of Endologica products. And then when you read the individual results, you can look at individual medicinal plants, vitamins, minerals, diet, etc. if you want to create your own custom formulation or use an off-the-shelf product that contains those products. Now, this table will also show you if those indexes are found in any other GEMMA panels. So as you can see, we have StressCheck and EndoCheck in blue because they're super panels like ImmunoCheck. And then just for reference, we also have the allergic tendency and the inflammation level 1. We have the structure function index, which we saw in StressCheck, and the macrophage phagocyte system activation index, which was also found in StressCheck. And then we have a new index called the hyperimmune tendency. And then we have all the components that go into determining hyperimmune tendency, and then which also specify what types of innate immune cells might be overproduced. So, and S means structure and F means function. So when it comes to hyperimmune tendency, you'll see a discussion of the risk in structure and the risk in function. And you have the cata-ana index, the genital ratio corrected, the genitothyroid, and the adaptation indexes to look at the neutrophil to lymphocyte predominance and the eosinophil to monocyte predominance. So the allergic tendency index is an improved formula to evaluate hypersensitivity syndromes because not only does it include cortisol and histamine, but it also evaluates estrogens to better understand their role in the critical terrain in perpetuating the hyperimmunity state, as well as the risk of extravasation of immune cells. And the interpretation of this new allergic tendency index is is contextualized to these other results that we talked about, the alpha TRH yoking expressed in the locus coeruleus index, the risk of spasmophilia, and the relative predominance of neutrophils versus lymphocytes. So now this algorithm or arborization starts to make more sense, because what I'm showing you is how the panel determines what type of allergy it is, and then that's how it determines the specific endologic products which best address each of these different phenotypes, including autoimmune risk. Now, the second new thing in this panel is the hyperimmune tendency index, and this evaluates the risk of overproduction of immune factors. Now, the panel cannot determine if your patient is vagatonic or if they have a secondary overstimulation of parasympathetic activity. You need to determine that through your history taking and your exam. But this can evaluate the precritical terrain. And a high index does not necessarily mean that you have an allergic tendency. So it goes through several layers of categorization in order to try to give you the most precise estimation of this hyperimmune tendency. So if you see that the index is high, but the catabolism anabolism index is not low, and the general ratio is not low, you don't have a hyperimmune tendency in the precritical terrain. You just have a high index, but it's not because necessarily you're in this phase, this precritical phase. So the algorithm makes that distinction, and then it also checks those results. So even if you don't have a true hyperimmune precritical terrain, as long as the index is high, it's the panel is still going to tell you, okay, well, you still have a relative predominance of neutrophils versus lymphocytes or eosinophils versus monocytes, and it's still going to recommend various treatments if you want to use them to regulate immunity anyway. And overall, here is an algorithm which basically goes through everything we just said. So the panel will say, okay, is there an allergic tendency? Is the index high? There's some risk of type 1 hypersensitivity. If it's low, there could be a risk of types 2 to 4 hypersensitivity as well as autoimmunity. Again, it's just screening for these other types of hypersensitivities. You'll need to do a standard workup beyond that to be more specific. If the allergic tendency index is normal, you can still look to see if there's a critical terrain, okay? If the index is not high, then you don't have hypersensitivity and you don't have hyperimmunity. At least you don't have what we can determine only using a CBC. If it is high, again, if you don't have a hyperanabolic predominance and a hyperestrogenic predominance, then it's still not likely to be hyperimmunity or hypersensitivity. It's only in this last case that we consider it a hyperimmune precritical terrain, but they're not technically in the critical terrain of hypersensitivity. The summary and the scores are also a bit unique in this panel. The summary will show you the presence of the critical and or precritical terrains, and it'll just sum it up in one phrase for you. Like it'll say, this patient has an allergic tendency and a precritical tendency. Or it'll say they don't currently appear to have allergies, but they do have a hyperimmune terrain. Whatever the total summary is, it's going to give you that in one line. And then it'll recommend the essential endologica products. And if there's both an allergic tendency and the hyperimmune tendency. It's going to recommend the essential treatment for the allergic terrain. Only when the allergic terrain is not present, it'll say, okay, well, you can still use this to focus on the precritical terrain. What's unique to this panel is that there's two different scores. There's a global score, which is called the immune imbalance score, and that'll give you an interpretation of the overall terrain. And then there's an inflammatory subscore, which basically is summarizing everything you would find in the inflammation panel level 1. And not only does it give you a score, but there's also an interpretation of the inflammatory nature. And it's looking at this interaction between immunity, inflammation, and the endocrine system. The highlight section will tell you if there's an atopic tendency or a non-atopic tendency, if there's a mixed endocrine immune inflammation, or it's a primarily endocrine driven or primarily immune driven. It also will talk about tissue hypersensitivity and suggest the possible role for low-dose azithromycin to reduce neutrophil elastase activity and eosinophil activity related to chronic inflammation. And once again, just to remind you that we have these different phenotypes of allergies, and then we have the different types of endologica products, depending on the very specific terrain. I didn't put type 7, which would be those people at risk of uh, hypersensitivity types 2, 3, or 4, or other autoimmune conditions, but they would be recommended Cataquel, which reduces adrenal activity. So this is ImmunoCheck. And as you see here, there's a summary. In this case, we haven't even looked at the details, but right away it says that there's systemic hypersensitivity with risk of ongoing immune hyperproduction. And it's recommending Catavance and Toniquel. And it's saying the immune imbalance score 65%, which is major impairment, and the inflammatory subscore is 54%, which is advanced immune inflammation. And right away, it's going to tell you, because you're going to be asking yourself, okay, but what does this mean? And it says, well, the inflammatory orientation is moderate atopy because of the level of histamines and the lymphocytic predominance. And it's hard to say if there's tissue hypersensitivity. It can't be ruled out. You'll need to ask questions like, do you have muscle aches and low-grade inflammation, etc. And then it goes through the adaptive and basal hyperimmune tendency. And it says, okay, the reason this person has a hyperimmune tendency has to do with how they're adapting. They have a latent risk in structure in their basal metabolic activity, but the problem is really in adaptation. And then, as you've seen in the other indexes, you'll have the top line determination of the allergic tendency, with the normal range, the value, and a discussion. Then it goes through the individual indexes that we've talked about, locus coeruleus, cortisol. And what's new also compared to the the allergic tendency panel, is that there's a qualification of how elevated the histamine activity is. So there's elevated, and very, very elevated. And then there's also a discussion of the spasophilia risk. So that concludes the evaluation of the critical terrain. And then we have tissue hypersensitivity. This is exactly what you saw in StressCheck, the structure function index, and the macrophage phagocyte system activation, or MPS. But the interpretations are different here, and they have a greater orientation towards the question of immunity and allergies than you would find in StressCheck. And then we get to the precritical terrain. First, you're going to see the hyperimmune tendency. Now, don't be alarmed. The value of the index is always the same in structure and function, even though they have different formulas. That's just the outcome of mathematically how I created them. But the interpretations are different because they're based specifically on these results. So catabolism, anabolism, and function and genital ratio are going to determine the functional risk of hyperimmune tendency. And then catabolism, anabolism, and structure and the genital ratio corrected are going to determine the structure risk. So you see, even though the patient has the same index value, the interpretations are different based on the component results. So once again, it says hyperimmune tendency in adaptive metabolism, but latent hyperimmune tendency in basal metabolism. And it'll explain specifically why that is. But you can look at the individual results and it'll give you a clinical interpretation. And then at the very end, there's a second level of analysis that says, okay, let's say there is this hyperimmune tendency. What exactly is there a tendency towards? And it'll say if it's neutrophils versus lymphocytes, and for this patient, it's lymphocytic predominance. And here to look at eosinophils and monocyte. Now their ratio was in the high end of normal. They'll just say it's a non-eosinophilic predominance. And the question of monocytes and basophils are addressed in the macrophage phagocyte system activation index. And like in the other super panels that have this, you have a quick summary again, but with essential treatments, other types of diets that you might want to consider, secondary support. So it says, okay, well, in general, because there seems to be a risk of an active allergic terrain, think about using Catavance and Tonic-Quell. But because of this adaptive hyperimmune tendency that has a lymphocytic predominance, you might want to also consider Levovance and adding that to the patient's treatment. And then once again, you'll have a summary. So the top line assessment, allergic tendency, I've simplified the interpretation. It just has the Endologica formulations and other panels you can use to expand your understanding of the terrain. And then in the individual results, you'll find individual plants. And based on their actions, if it's, for example, improved cortisol, anti-allergic, polyvalent drainage. I tried to simplify the way you read the result. You'll see some vitamin mineral recommendations, dietary recommendations. When it comes to a low histamine diet, what's also new and that you won't find in the allergic tendency panel is because of the ranking of how high the evoked histamine value is, it'll give you a very specific recommendation of how closely the patient has to adhere to the full low histamine diet. So it says that because there's an intermediate, there's a very high level, it's an intermediate level of observed, which means eat low histamine foods and avoid two types of things, histamine-rich foods and those blocking diamine oxidase. And the third type, which stimulate histamine release, you don't have to ask them to avoid if they find restrictive diets too difficult. You'll see all sorts of other treatments you might be familiar with, like glutathione, selenium, PEA, quercetin, etc. And as always, you'll have a summary of the basic lab results. You have a guide on how to read this panel. Pretty much what you heard me talk about today is recapitulated here. So you'll have all of this with you as you go through it. It talks about the scoring, the highlights. Here's that comparison table again. Here's a summary of the different treatments that we talked about. There's a discussion of why the combination of the specific Endologica products would help each type of allergic or hypersensitivity patient. We have a detailed discussion of the diet, and I included the ranges here for you to be absolutely clear on why I've recommended avoiding certain degrees of strictness of adherence to the low histamine diet. There's also a guide on how you can encourage your patient month by month to avoid a new category of foods. And then here's a handy reminder of what these foods are for each part of the diet. There's also an expanded list of other types of preservatives which can trigger histamine release. There's a guide to environmental toxins that can affect cortisol, a quick reminder of signs and symptoms related to the corticotropic and thyrotropic axes, a discussion section. So here I'm going to explain immunity to you in a slightly different way from what I did today. Then it'll go through every single index and it'll talk about the issue, the physiology, how the index was composed, and what a high and low value means. So you can read about this. I just want to conclude by showing you the table of drug-drug and drug-herb interaction. So let's say your patient is already taking an antihistamine or some type of anti-inflammatory, and you wish to use one of the Endobiogeny products, or you're using one of the individual ingredients in your own formulation. You can just take a quick look here to see if there's any possible interactions with antihistamines and anti-inflammatories that your patient may be taking, including the recommendation of azithromycin. And you can just dose accordingly or choose alternates. And then, of course, there's references at the end.